Hello, I'm Dr. Adnan. Today, we will explore the range of possible causes of the vomiting of blood called hematemesis. It will be beneficial in a number of other ways. In addition to daily practice and in the exams, I'll focus on some of the most significant causes of hematemesis out of the many that exist. Let's start with the history taking. Elaborate the hematemesis first. We can remember with the mnemonic ODPARA. O for onset, whether it's sudden or gradual in onset, plus number of episodes. D for duration of each episodes and when was the last episode. I for intensity or amount of blood noticed. P for progression, is it worsening? A for aggravating factors. R for relieving factors. After elaboration, inquire about A for associated symptoms. Based on elaboration, suspect few differentials and ask associated symptoms. Ask about the appearance of blood. Was it fresh or mixed with food? Now past medical history, we will ask for history of similar conditions, diagnosed with any medical conditions like bleeding disorders, taking any medications like blood thinners or over-the-counter medication, any supplements or herbal medication, allergic to any medications, history of recent instrumentation, hospitalization and previous surgery, history of any family diseases. Coming to the personal history. Elaborate diet, smoking, alcohol. Here alcohol history is very important as it is associated with esophageal varices due to underlying liver condition. Physical activity, stress, recreational drugs. Sexual history. Ask for TOL. T for travel, O for occupation, L for living condition including housing and with whom he or she is living. Asking every question would be unnecessary in history taking, instead only pertinent ones should be asked. Let's move to the differential diagnosis of hematemesis. We can remember the many possible causes of hematemesis by considering numerous potential sites. Starting from stomach, peptic ulcer. Due to NSAIDs, stress, H. pylori, or Zollinger-Ellison syndrome. Lower end of esophagus, gastroesophageal varices. Mallory-Weiss tear. Esophagitis. Cancers, including esophageal cancer, gastric cancer. Symptoms of anemia and dehydration will be seen in almost all the cases of hematemesis. Let's now address a few important pathologies and the crucial questions we must ask. Starting with the gastroesophageal varices. Gastroesophageal submucosal venous channels become dilated secondary to portal hypertension caused by underlying liver diseases. Gastroesophageal varices usually don't cause signs and symptoms unless they bleed. Signs and symptoms of bleeding esophageal varices include vomiting large amounts of blood, black, tarry or bloody stools, lightheadedness, anemia. Symptoms like palpitations, fatigue, shortness of breath, paleness. Dehydration symptoms, feeling thirsty, dark yellow and strong smelling urine, decrease urine output, dry mouth, lips and eyes. Signs and symptoms of underlying liver diseases like jaundice, abdominal pain, easy bleeding or bruising, ascites, loss of weight, loss of appetite. In severe cases, loss of consciousness. Features of hemorrhagic shock. Moving to the Mallory-Weiss tear. A Mallory-Weiss tear is a tear of the tissue of the lower esophageal mucosa. It is most of 10 caused by violent coughing or vomiting due to factors like excessive alcohol intake, bulimia, hyperemesis gravidarum, trauma, hiatal hernia. Symptoms are vomit that is bright red or that looks like coffee grounds, black or tar-like stools. Anemia symptoms like palpitations, fatigue, shortness of breath, paleness. Dehydration symptoms, feeling thirsty, dark yellow and strong smelling urine. Decrease urine output, dry mouth, lips and eyes. Associated with a history of factors mentioned above. Let's now discuss peptic ulcer. A peptic ulcer is a breach in the lining of the stomach or duodenum. Rarely, a peptic ulcer may develop just above the stomach in the esophagus. It's called an esophageal ulcer. Risk factors for peptic ulcer are long-term use of NSAIDs, stress H. pylori infection, or Zollinger-Ellison syndrome. Symptoms of peptic ulcer are burning or gnawing pain in the epigastric region, indigestion, heartburn, acid reflux, feeling of fullness, bloating or belching, intolerance to fatty foods, burping, poor appetite, weight loss. In severe cases, leads to upper gastrointestinal bleeding, and sometimes perforation. Let's discuss about esophagitis. Esophagitis is the inflammation that may damage tissues of the esophagus. Causes of esophagitis are gastroesophageal reflux disease, infection, oral medications like bisphosphonates, tetracycline group of antibiotics. Symptoms are dysphagia, odynophagia, chest pain, particularly behind the sternum, that occurs with eating, food impaction, heartburn, acid regurgitation. Finally, let's discuss red flags. Uncontrolled hematemesis, excessive loss of blood in vomitus. Features of hemorrhagic shock like cyanosis or pallor, excessive sweating, shallow breathing, loss of consciousness, confusion, low blood pressure, tachycardia, feeble pulse, anxiety and a sense of impending doom. Prolonged capillary refill time. Other red flag symptoms are weight loss, lumps or bumps anywhere in the body. Thanks for watching. Do like, share and subscribe to the channel. And don't forget to press the bell icon. Follow us on Instagram. And don't forget to share your important reviews in the comment section.